So my name is Marcy Devoto, and I am one of the OT Fieldwork Coordinators. What that means is I'm one of the 3 faculty members that help set up your fieldwork internships. We call those fieldwork. Sometimes in nursing it's called something else, and in PT it's called something else, but in our profession we call it fieldwork. There are 3 of us, and the reason why there are 3 of us is there are actually 3 programs. Y'all are in the Norcross Day program. There's also a Norcross Evening Weekend program, and there is a Gainesville Day program. So each of us kind of represents each group. I'm the representative. Yay! So, and my office is down the hall, that little hall. It's across from Dr. Foley's office. But if you ever need me, that's where I am. So that's kind of how we designate what we do. The other thing, the other designation is my area of expertise is in brain injury and mental health. So I set up all the mental health field work. Charles sets up all the older adult kind of medical field work. And then Janine is responsible for the pediatrics. So we kind of dip into different areas. So you'll see each of us at some point when you're here. Any questions about that? Just a little background on me. I used to work, I've worked in academia for, I don't know how long. It's been, let's see, my son is 4, so about 4 years plus about 10 years, maybe 7 years in academia as a fieldwork coordinator. In between that, there were sections of when I worked in brain injury at Vanderbilt, outpatient brain injury, and then I worked in a psychiatric ward. And then I worked at Shepherd in a small clinic that treated veterans from Iraq and Afghanistan who had PTSD and brain injury. So I kind of have the combination experience. So that's who I am. I've also done a little peds, but that's not my bag. I do a little. I dabble in it, and I love my child, but and I think children are really cute. So, but that's not my expertise. So it's a little bit about me. So if you're ever interested and you want to just chat, you can come talk to me about this. So what is fieldwork? Does anyone know a little bit about what fieldwork is from your observations or anything?
Internship, and you're just going out and working in a facility.
Yes.
With professionals that you can observe and you can try out.
Yes, it's just an internship. Yeah. So we have different levels of internships called fieldwork. The first, as Dr. Foley said, the first experience is your community partner, and we consider that a fieldwork. That's when you first get exposed to people who have a disability. And you're in that fieldwork, you're really looking at kind of what is that like as a person, as an individual, which is kind of nice to see because then you can kind of, in some way, put yourself in their shoes. And that's important to have that step. The next level of fieldwork, you're going to have fieldworks in pediatrics, mental health, community-based, and older adult. So those are called level 1s, and those are about 4 to 6 hours a week for 10 weeks. So that's embedded in your semester. So for example, during your pediatric semester, you may be placed at a pediatric clinic, or you may be placed in a school system. Or we have what's called the Center for Productive Living, which is, for lack of a better word, it's kind of like a clinic that we have on site where we bring OTs in and they help guide students to do student treatment with patients. So those are some different opportunities. We also have camps where you go. There's a brain injury camp in the fall where we send students for level 1s, and you're there for about 4 days, 24/7 with, well, 24/4 with those clients. And so you're with them every part of the day, so you get to see how they dress, how they go to the bathroom, how they play, how they eat. So it's just a really good experience. So those are some examples. Your designated day for fieldwork is Thursday, so everybody needs to write that down right now. Do not schedule any events, any work or anything. That's your designated day. So that's like a class. That is a class. So really make sure you remember that. Just to confuse you, the only exception to that is your mental health community-based fieldwork semester, and that's a really weird semester when it comes to fieldwork. You're placed in pairs. So, for example, you might be at the O'Hearn House, which is a housing facility for people with chronic and persistent mental illness. So you might go down there in the evenings, and those days really range. So we'll try to give you a heads up before then, and that's going to be your winter or spring semester 2016. Right? Yes, because y'all do adult, mental health, and then peds. Right? I have to keep 3 programs straight, and they have different orders.
I told them that's why we're confused all the time.
Yes,
There's 3
I know, I need like a little map all the time. So just remember that spring 2016 is going to be that kind of weird one. So just keep it in your notes, just keep it in mind.
And we'll remind you.
And we'll remind you, but it's just nice to know. And I know we're bombarding you guys with a lot of information today, so we'll repeat this information. We'll send out newsletters, we'll send out emails. Just make sure you read everything that comes out. If you don't, you might miss something. So those are level 1s. Level 2s are basically a full-time internship. And in order to meet ACOPE requirements, you have to do 24 full-time weeks of field work. So that's going to be at the end of your stay here. So that will start, I think, in January of 2017. It's really close, I promise. First semester will feel like it's far away.
It's even closer when you're setting them up.
I know. So we send folks here in the Atlanta area. We can send you out farther. We've done international fieldworks. We've done emerging practice. We've done mental health community-based. We will probably send out, and Brittany, we usually do that, the second semester or end of first semester? Mm-hmm. We try to send out requests for that early on because we've got to schedule these things really far out, and even when we do that, things happen. So just kind of keep in mind, if you're interested in going out of area, that's great. We love that because there are a lot of students in this area, so we have to really be cognizant of that and make sure we can find good placements. So that's your level 2. It's really kind of a fun culmination of everything. So all students kind of look forward to that. Can't wait if I could just get to my level 2s. So that's, and like Dr. Foley said, when you graduate here, you should be at entry level in terms of practicing. So don't worry so much about, I really want to go into peds. I have to get the perfect peds site. You need to think about really diversifying yourself and trying to see how, you have to be in 2 different settings. So if you are interested in peds, do peds and then an adult in either skilled nursing or in a hospital, just so you can take your exam and also be an entry level. So I think a lot of students panic when it comes to level 2s. It's a moment in time, and it's a wonderful moment in time, but it's a bigger picture than just finding your first job. So, and we'll guide you through that process. It's a fun process. What else do we have to say about how are fieldwork placements set up? I bet you're wondering. What we do is we have this great matrix, and so this is where it's really important to always keep your information updated and eValue. We take where you're from, like if you live in Marietta or if you live in Norcross, and we have designated sites that we've found. We try to match you up so that you're within 45 minutes. We shoot for within 45 minutes travel time. In the handbook it says 90, so we can go up to 90 minutes, but we kind of shoot for 45. So we try to map you out so that we schedule you so that you don't have to travel too far. Uh-oh. Oh, you're welcome. But please plan on, for fieldwork traveling, you are going to have to travel at least 45 minutes. And if you don't, man, you just won the lottery. So it just, sometimes it works out great. Sometimes you nail it and you don't have to travel far, and sometimes you do. Really look at it from your experience and try to get the most out of your experience. But budget, because I think that's another thing that we always forget about is you got to budget for field work. And that's one of those hidden costs. So remember mileage and gas money. So when you're looking at your budgets for your time when you're in school, make sure you think about that as well.
Do you want to just mention the kind of like what it's like to schedule field works with respect to the other health professions and kind of what's going on in the process right now.
Oh, how it's
Just
crazy?
why it's so challenging, just a minute or two on that.
Yeah,
Just so they understand why it's not,
Easy.
why isn't it easier?
yeah. That's a great point. As y'all probably are very well aware, that healthcare in the United States, and all over the world really, is always changing, but right now it's really going through some major changes. So how that affects students and how it affects placements is that productivity is up in sites and facilities, so that means therapists have to treat more. They don't have as much downtime. They also have a lot of changing in their documentation and what they're doing, and so there are a lot of changes in clinics. So it's really hard to take a student. Even therapists who love taking students, it's really hard because it takes time, and they don't have that extra time. They used to have a lot more time to kind of process with the student, and now they don't get paid for it. And they do it because they want to advance the profession, and they care about continuing the profession, but it makes it challenging. So that's one criteria. And some sites now won't even allow students. Some home health places won't even allow, the big company won't allow the therapist to have students just because of that productivity. So it's pretty tight all over the U.S. We have some really good relationships in this area and in some other areas, but again, there are always changes, and so it's always a challenge. The other thing is there are a lot of students. And so when we're placing, and you have to think about what they're 30, 32 of you guys now. So if you multiply that times 3 in just the Norcross day, so that's 90, plus the other 2 programs that we have, that's going to be 270 students in this area, just from our school alone, doing field work every semester.
And
So
that's
that's a
not
lot.
nursing.
Yeah, that's not
psychology,
nursing, and that's
physical
not
therapy.
PT. So see how it gets big, and then we're just one school. And then you add Georgia Regents, and you add Brown Mackey, and you add Chattahoochee, and then there's another one coming up. Who's
Georgia State.
Georgia State is now starting one. So see how there are a lot of students. So it can be a challenge, and that's why it's really important to understand that. But we always find places. So I'm just teasing. Does that help?
Yeah, that's
You want to
good.
add anything
No,
about that?
no, I just wanted them to kind of get, I think if you understand the big picture, it helps you understand like, oh, why are they sending me here when I could go down the street?
Yeah.
It's because we might have somebody down the street already, and, you know.
And the other big thing is, when we place a student, we have to make sure that that site matches our curriculum. So that's another thing. We may have there may be, or you may think there's a great site that's down the street, but we've talked with them, and what they do there doesn't really match our curriculum. So we can't set up a placement there. And that's why we're constantly also reevaluating that, because that changes. Sometimes at one point they did, and now they don't. And then we also know about certain fieldwork educators, and we want to make sure that the ones that supervise y'all are good. And if we've had an experience where there has been somebody who's not been very helpful in supervising, we don't try to use them again. So again, there's a lot behind the scenes that we try not to show you all because it's just too much. And like Dr. Floyd said, you guys are so stressed when you're in the program. To add one more thing is just a lot. It's a lot. So we try to shield you from some of those details. But from your perspective, it may feel like, what is going on? So, what else? So level 2 is how do we arrange that? What you do is you fill out a form that says, these are my top areas of interest. So I might be interested in adults, and I might be interested in adults in acute care, hands, burns. I might be interested in peds, NICU, working with kids with autism, working with kids with CP, that sort of thing. So you put in your interest, and then you put in where areas of the country or regions that you're interested in. And we match you guys up. So then we try to figure out how that works. If you want to go out of area, say for example, someone is from Canton, Ohio, what you'll do is you'll say, hey Marcy, or hey Janine, or hey Charles, I'm interested in going to Canton, Ohio, and we'll work with you. We'll say, okay, I want you to investigate 3 different places for each field work in that area. And when we say investigate, what you do is you look it up and you try to find a contact person. What you don't do is you say, hey, Mr. Smith, can I have a slot for January 2017? Because that just mucks up the water and it just is not professional. So, but we'll guide you again through that process. So that's how that works. Any questions so far? Or y'all like filled up to here with information?
I actually have a question. Is this the same thing as clinical rotation?
Yes.
Okay.
Yes. Great question. Yes. Yes. Okay. What else? Budget for. The other thing is budget for transportation, gas, and parking. In field work, sometimes you're required to park and pay for parking. Sometimes you're required to wear scrubs or certain, not uniforms, but certain things. So, you know, go ahead and buy your khakis and make sure you have appropriate shoes. Like my open-toe shoes are not appropriate. There's a reason for that. If you're going into a hospital setting, you're going to deal with body fluids, and you really don't want poop all over your feet. So, I mean, that's just a graphic way to really, but there are rules against it, but that's the logical reason. You just don't want stuff all over your feet. So, you can wear tennis shoes, you can wear something like Clark's or something that's comfortable, but you got to wear socks and shoes. So, no flip-flops. Just be prepared. So, go ahead and invest in those shoes if you don't have those. So, budgeting. I'm trying to think what else. If you are going out of area for your field work, make sure you budget for that too. Some people want to go to kind of new places. I have a student who's in Hawaii for her level 2. And so you got to budget now. It's expensive to go if you don't have contacts in that area. You have got to start that budgeting. And I would recommend right now that you sit down with yourself, whoever you budget with, and look at the whole time you're here and say, okay, this is how much I'm going to budget each semester. Because that financial aid or your money gets really thin at times. So it's kind of nice to get an advanced look at what you're expected to pay. Immunizations. Immunizations, please do them as soon as possible. You will do, you're required to, did everybody get your list of what's required?
I can go over that one if you don't remember it yet.
Perfect. Yeah, you want to go over that and then I'll go over professional behaviors and that kind of
Works
thing.
for me? Yeah. So yes, the little sheet on the top that says, I think it was on the left side of the folder, the value requirements to upload. All right, so basically these are all the immunization documentation requirements that you have to have not only for the program, but for fieldwork. So basically any site you go to is going to request any or all of these documents from me at some point or another. We'll just run through, I'll run through them real quick just so everybody understands kind of what's on here. Cpr certification, that's got to be the basic lifesaver healthcare provider. Most people choose to go through the American Heart Association. I can provide you guys with some contact info. There's one particular company who, if you guys all wanted to get together, they will actually bring an instructor to campus, and you could all just meet here one day, like speak with someone, reserve a room kind of thing, or you can go about it on your own, whatever is easier. The second one, background check and drug screen. This is a program requirement, not just a fieldwork requirement. And you'll see on the same side of that folder, there's an Advantage Student Information Sheet. I have on here that we really need you to order that before the first day of class. That just makes it, one, it takes a little bit of time, and two, if there's any flags, people with common names get mixed up, we can take care of all that so you have a smooth start to the semester. Again, that info sheet should lead you through how to order and everything, but if you have any questions, you can always contact me directly. The physical exam is a yearly requirement, so if you get one now on April 9th, you will have to get another one before April 9th of next year. So it's a yearly requirement. The system that you upload it into will remind you, and I try to send email reminders. But at the end of the day, as I said, this is a professional program. You guys, be going into a professional career, so we kind of expect you, while I'm a very detail-oriented person, I really need you also to kind of keep an eye on your own stuff just to make sure something doesn't fall through the crack. Because if that happens, then you can delay your field work, and that just throws everything off, and you don't want to stress you out like that. So this form is our physical form. It's front and back. It's the easiest, you don't have to use this by any stretch. Any doctor's documentation is totally official and fine. But this is a really easy way to record all of your immunizations, your titers you've had, your annual TB test, which is also, like I said, if you got that today, you have to get another one before April 9th of next year. And so all that's just one easy document to record it on, or you can get all different ones from your doctor. Whatever works.
Okay, ready?
Yeah.
On that too, make sure you have to have dates and a signature. from the
Oh,
doctor.
yes,
If you
the
do not
dates.
have that, it doesn't really count, and it's not documentation. So this is official documentation that has to be included in your evalu. If you go to a fieldwork site, they will not allow you to come, and you may not go to fieldwork, so you will be delayed in your program. So it is vital that you do that.
And on top of that, as Dr. Foley and I were talking before it started, a facility gets checked and we have one of you out there come to find out you don't have your Hep B vaccinations up to date. Not only does that pull your field work, but that runs the potential of the site not wanting to work with us anymore because they're going to get slammed hardcore. So it's not me being mean, it's not me bugging you, but I will probably email you 1,000 times until we get everything we need. So just be prepared.
And ultimately, you're at risk for infecting patients, and the most important thing is you're protecting of the patient. And so if you don't have your immunizations, you're really putting patients at risk. So think about it from that perspective, not necessarily from we're just trying to put the, take that.
So I have a question. So for the requirements to upload it, files, everything, so it looks like most of them are just right here.
Mhm.
Okay, so once this is complete, we can upload this and this takes care of most of it. Okay.
And what I'll do is, you have some how-tos in here. It's kind of a lot. Sometimes I'll pull it up, but it's kind of a lot to look at one time. But basically, you'll open up eValue, and there'll be a section for everything. And you'll upload your document, and you will put in the dates, which are important, as she says. And then I will go back in, look at the document, make sure the date's actually there, and then verify, so you're good to go. But yeah, that same form can be uploaded in each of those spots if you choose to use that. And one thing just to point out, if any of you feel like you want to travel, that form can be used at the Gainesville Student Center for Health and Wellbeing. I can give you that contact info for a free physical every year. They won't do any of the vaccinations or anything, but once you get those one-time vaccinations out of the way, you can return there for the physical if you wanted to.
Do they do the flu shot too?
That I'm not 100% sure. I'd have to check. Keep going down the list here. Hep B, you either have to have documentation of all 3 shots in the series or a titer showing that you're immune. So that's just a blood test they'll draw and decide if you're immune or not. If it comes back that you're not, you'd have to start the series over. Of Hep B, same goes for MMR. There's 2 shots in that series. You can't obtain documentation. You can go get a titer for that. Chickenpox, for our program, we only require history of disease or, again, one of those titers. But I'll just go ahead and warn you, especially a lot of the pediatric facilities are requiring going ahead and getting that titer. They're not counting proof that you have the disease at 6 as enough anymore, so just be prepared for that. Tetanus on there, medical insurance card. You have to have personal insurance the entire time you're here. I always try to set the date on that. That expires every year, because if you don't get a new card every year, just kind of keeping updated and keep current, because some people fall on different schedules than others. AOTA and GOTA, AOTA is the national organization, which is a conference that everyone's going to next week, and that is a requirement to join in the program, as well as GOTA, or for anyone who's out of state, if you prefer to join your state organization, that's fine too. But basically for those, you can just upload screenshots of email confirmations or whatever, but again, just make sure there's an expiration date on everything. Let's see.
And this is all an eValue.
This is all in eValue, and basically, let me pull one of these sheets. Here it is, right here. So these little how-tos that Summer put in, I'll email these all out as attachments so you can save them as well. And I'll email out your account information, how to log in and everything. But this should guide you step by step on how you upload all of these things. And then once you do, just shoot me an email and I can go in and verify for you. This is where the contact information as far as your address and stuff will go. So when you're going in to fill it out, there's a sheet in here that's how to update your contact information. Be sure that the address you have in there is what you want us to use to place you for field work, if that makes sense. So don't put your parents' home address back in Massachusetts, or we're gonna think you wanna go there one day a week for your level 1, and that would be way too expensive for you. So just keep that in mind, always keep that updated. Missing any documents? Again, I put the deadline dates on here as May 31st, just because I know a lot of you will be, might be moving into town or whatnot, so it could be, a lot to get in before you start classes. But I would really, really, really strongly encourage you to get everything in as much as possible before you start the semester. Because at that point, it just becomes a whirlwind, and you're so busy, it's almost impossible for me to get your attention for these things. And then your first fieldwork semester hits, and you're delayed because you're missing a few immunizations. So that's definitely something to think about if you have that option. If you have any trouble uploading or anything, you can always come see me in my office. It's down that same little alcove where there is, and we can scan stuff together and do a little tutorial if you need it. That's no big deal. And I guess my only last thing is, again, just keep in mind that these are, for now, program requirements. So just because you go to a fieldwork facility that may not require these things, you still have to have them to be in the program. But also keep in mind, you may go somewhere that requires double what's on this sheet. And as much as it may stink, they may make you get another background check, or they may say, well, your PPD has to be within 3 months. So it kind of goes back to that budgeting. Just always know, depending on where you're going, there could be those additional requirements. So that is a ton of stuff. And I will email you guys out all of your account info and really detailed instructions on what to do. And then from that point, you can start firing questions.
Any questions for Brittany?
Yeah, anything else on the head, you already You will.
The background check, did it say in your wording to get that done?
Yes, this one right here, it goes through advantage
Oh,
students,
okay.
and the only reason we require that is because most of the hospital facilities around this area, that's what they require and use, so it just makes your life a lot easier, we can just share it electronically, so.
Hey, just to clarify, fieldwork level 1 is community-based and level 2 is,
No. Fieldwork 1 is shorter, smaller internship. Level 2 is full-time. Level 1 could be in a clinic, community, a school system, a hospital system. So it really runs, or a clinic here, a free clinic here. So it kind of runs the gamut.
our background check has to be through this company, is that correct?
Yes. And back to, I'll keep your hand up, it's all good. Background checks, some sites, like Brittany said, do require an additional background check. Again, just budget maybe a couple $100. If you have extra, you can always pass it on to the next semester, but just for fieldwork cost, I would just always, because an additional background check can be up to $100. And then sometimes people require fingerprinting, and some people require like the TB. A lot of places now, just heads up, are requiring flu shots. So if you're going into the fall and spring, usually you're required to have a flu shot. So just again, budget, prepare. I'd like to give you that information so there are no surprises. Yeah, no, I don't think they do that.
No.
I think you're gonna have to go to a doctor for that. And I don't even know if like a Minute Clinic would do that. I'm not even sure. And unfortunately, if you have a positive, I think it's on a yearly basis maybe, I can't remember. And different sites will have different requirements for that. So, but that's something to, maybe we can talk later if anyone needs a chest x-ray. Sometimes you'll have a positive for TB and you may not have the active tuberculosis, so you have to get a chest x-ray. So it is a pain, but it is reality. The other thing is when you go out in the profession, this happens all over again.
You're gonna have to do this
Yeah.
again, so save your stuff.
I was gonna say, keep a folder of all your immunizations, and just put it in a lockbox, keep it where you always know where it is. You will need this going forward forever. So it is much easier if you have it all together than for you to gather it again, in 3 years when you're out trying to find a job, because they ask for the same exact thing all over again. So, welcome to health. Any other questions about that stuff? Questions? All right, professional behaviors. So we're going to talk about this for the rest of the time you're here. Professional behaviors is part of being healthcare professional. And part of that is we have a contract as an OT with society and with our clients. You're given privileges because we are in that profession. We're allowed to do things that most people are not allowed to do. We're allowed to touch patients. You know, they're privileges we have, and so with that comes some responsibilities. So that's part of professional behavior. So I want you to remember that as you go through this.